podcast.
So Mexico is a very important country for us as a company. We are the largest pharmaceutical company in the country. It's important because we actually develop our products here. We do a lot of clinical trials. We invest in R&D in Mexico. Of course, we commercialize our products, but we also manufacture. We make 40 million packs of products every year. We export from Mexico to some countries in Latin America. And we also have a very large technology center in Guadalajara, where we have now 1,100 people growing to 1,600 people very soon this year, actually. And they do IT, and they're working on artificial intelligence solution, IT, digital technologies. So Mexico is important to us, not only because we want to bring our medicines to patients in the country, but also because it's a core part of our global organization. I see it really as a soccer team. You constantly have to upgrade.
Yeah.
You may have a team that is good. You win the national championship, but now you want to win the regional championship and then the world championship. And each time you have to upgrade when you have an opportunity, and that's what we've done. The way to do it is really to spend time meeting people. So most of my time I spend traveling and meeting people in R&D, in commercial, in the various countries, everywhere.
Bienvenidos al rodcast, conociendo personalidades de alto impacto que comparten historias de éxito con Rodrigo Pacheco.
Estoy muy contento porque en esta ocasión, en este rodcast, me acompaña una figura de primer nivel en el mundo en el mundo farmacéutico. Me refiero al presidente ejecutivo y director general de Astra Zeneca, una de las farmacéuticas más importantes a escala global, con unos resultados financieros extraordinarios. Estamos hablando de $58,000 millones en 2024. Pascal Soriot, thank you very much for giving me the time for this interview.
Thank you for having me, Rodrigo. It's really a pleasure to be here.
First of all, ask you, how was 2024 for AstraZeneca, and what are the challenges you see ahead in this year, which is geopolitically complex?
Yes, we're living in a complex world, that's for sure. 24 was a fantastic year for our company. We grew by more than 21%. Our pipeline made very strong progress. Our focus as a company is in oncology, cardiovascular, diabetes, respiratory disease, but also rare diseases. We invest about $12 billion a year in research and development, and we've made enormous progress with developing new products. So last year, really a fantastic year for us, both financially, but also more importantly from a science and new products pipeline viewpoint. 25 is another year that is bringing its own challenges, and but also we think we are going to do well. This is a complex world, but as a company, we are used to dealing with uncertainties about innovation, about whether our products are going to work or not when we develop them. And the geopolitics is just one additional challenge or question we have to address, of course.
Exactly. And here in Mexico, we're a big country, the 10th most populated, 130 million Mexicans. We're in the demographic evolution. We're going to be in the necessity of many treatments as Astra. And this company has a very special place in Mexico because in the pandemic, it was the first one that bring us the solution to the COVID-19. So what is the role of Mexico now that you're here? How do you see it? Because we're not just a manufacturing center, but also a interesting market in terms of the number of Mexicans that we are.
Yes, absolutely. I mean, first of all, when we were talking about our top line sales growth last year, the international region grew tremendously, more than 30%. And Latin America is the biggest part of the international region. And within Latin America, every country is important, of course, but Brazil and Mexico are the most important. So Mexico is a very important country for us as a company. We are the largest pharmaceutical company in the country. It's important because we actually develop our products here. We do a lot of clinical trials. We invest in R&D in Mexico. Of course, we commercialize our products, but we also manufacture We make 40 million packs of products every year. We export from Mexico to some countries in Latin America. And we also have a very large technology center in Guadalajara, where we have now 1,100 people, growing to 1,600 people very soon this year, actually. And they do IT, and they're working on artificial intelligence solution, IT, digital technologies. So Mexico is important to us, not only because we want to bring our medicines to patients in the country, but also because it's a core part of our global organization.
Exactly. And what about the situation in terms of the North American region? Because you were saying you produce from Mexico to Latin America. What about the US? Because we're integrated, obviously, and we are in a very complex situation.
It is certainly a complex situation right now. In our case, it's relatively simple because we don't import medicines from China, Canada, or Mexico into the US. We have a very large manufacturing base in the United States, a large presence. So we tend to manufacture in the US for the US and import a bit from Europe also into the US, but we manufacture a lot in the US. In Mexico, we manufacture for Mexico and also for some Latin American countries.
Now, almost 10 years ago, or a little bit more than 10 years ago, one of the first challenges you faced in your leadership was the takeover of Pfizer. It's an standard in terms of the pharmacy industry, your vision, and now with the results of 2024, obviously your vision was right. But how was the experience in terms of looking at some vision, understand it, but fighting against the whole environment in terms of executing?
Yeah, it's a very good question. And first of all, I should say that I have a lot of friends who work at Pfizer, so there's no issue. Pfizer is a great company, and it just happened at the time we thought we can do better on our own. And it was really a time of stretching, testing our company and testing our strategy and our vision, if you want. And we had started, we had a plan, and we had started implementing this plan. And what this approach from Pfizer forced us to do was to communicate our strategy and communicate our plan, communicate our vision and our goals to investors, but also internally, externally to the media. And it really actually helped us crystallize what we wanted to do, what we think we could achieve on our own. And it was also a great way to mobilize the organization. I had lots and lots of people coming and saying, well, tell us what we can do to show that we can remain independent. So it was a stressful time, but it was also a very exciting time because it mobilized the entire organization.
Have you have some calls with investors and some people who were skeptic? Because 2024, really, I was seeing you projected that it was going to be the revenue $40 billion. You closed $58 billion last year. So you can call someone and say, I told you. Have that happened?
Yeah, it was quite interesting because, as part of communicating this strategy, we also had to tell people what we thought we could achieve. And we said by 2023, we want to achieve $40 billion. We believe we can do it with the pipeline we have. But of course, there was no certainty. There's zero certainty in our industry. It's an innovation industry. Science is risky. Innovation is risky. You can fail, right? But we felt with what we had in our hands, we could get there. But at the time, a lot of people thought, this is fake. You're making it up. You're saying this because you want to remain independent. So there were a lot of skeptics. And in fact, it's only by 2020, 21 people started believing, but not totally. In reality, we achieved the $40 billion not in 2023. We achieved it in 2022, so one year.
1 year ahead, yeah.
Yes, and now we've set our goal to be an $80 billion company globally by 2030. And Latin America will play a very important role in our growth, in our development as a company.
And also Asia, obviously, because the population density is huge. China, obviously, 1,400,000,000 Chinese, which is very important. But would you say the communication is the main component of leadership after you have described in terms of 2014?
Well, I think communication is an important aspect of it. Is really making sure people understand, first of all, have a shared purpose. So people understand why they come to work every day. They don't come to work every day just to kind of, do their homework, their office work. They come because they are all contributing to the common mission, which is developing new medicines for patients. And making sure people understand this and believe in it. That's key. It's easy to say, not so easy to have everybody believe in it and buy into it. Then having a clear strategy of what you're going to focus on, what kind of science you're going to pursue, what products you're going to focus your resourcing on, and what are your plans is really the next piece. And that is not really communication. It's really hard choices. Where do we place our bets? Where do we invest? And the third piece is really building a great team. And at the time, we had a good team, not a great team. We had a few people who really were very good, very great people, but we didn't have a large number of people. Today, I think we have a fantastic team all over the world. In China, you said about China, we are number one pharma company in China. In Mexico, for sure, we are also number one in Mexico, and we have a fantastic team. I've just spent 2 days with the Latin American team, and across the whole region, we have really excellent people.
Julio is a very good general manager here, but he's young, and that projects a lot in terms of the pharmaceutical business. But I want to ask you, how do you identify talent? When you were gathering this team, you need to have a lot more people. How do you say this is good talent? This is the resume? This is the attitude? You have some kind of way to identify, for example, this guy is not just smart, but also market-wise. What is your recipe?
Yes, I mean, first of all, at the time, as I said, we had to attract talent, and it was very difficult. Today, it's relatively easy because a lot of people are happy to come and work for AstraZeneca, but in those days, 12 years ago, it was difficult. So we started with a number of very good people AstraZeneca had at the time, but also recruiting new people, mostly people who knew me at the time, because it was quite difficult to recruit. And so we've really constantly strengthened the team. I see it really as a soccer team. You constantly have to upgrade.
Yeah.
You may have a team that is good. You win the national championship, but now you want to win the regional championship and then the world championship. And each time you have to upgrade when you have an opportunity, and that's what we've done. The way to do it is really to spend time meeting people. So most of my time I spend traveling and meeting people in R&D, in commercial, in the various countries, everywhere. And identifying, of course, the people who are smart, that's number one for sure, but also the people who have the right values, people who really understand and believe in what we're trying to do and have the right value. People who are smart, but people who are courageous and people who have energy. A lot of people are smart, but they're not necessarily courageous, or they may not have the energy. You have to have the energy to work hard and the courage to take risks. And the courage to take risks and fail, because sometimes we fail. We've succeeded over the last 12 years more than we have failed, but we have failed. When you fail, you just have to accept it, learn from it, and, get going again. So having people who are smart, courageous, people who are resilient, have energy, all of those things are personality traits that I'm looking for when we recruit people.
And also because in a very challenging environment as we have been living, because after that it arrived the COVID-19, which is a huge issue and biggest when you're a pharma company, and Astra was very important in that. How was that, and what are the lessons from that time? And I'm asking this not just you as a leader and one of the most innovating companies in that, but also we didn't know in March 2020 what was going to happen, what was the velocity. Maybe you did a little bit more than the rest of the world, but that's leadership in terms of you don't know in May if quarter of humankind was out or something. So yes. What was the lesson for it?
Yeah. We, as I said a minute ago, we have a large presence in China. We have 18,000 employees, and we're the largest pharma company. So we saw immediately in January of that year, we saw the epidemic, the pandemic. It was an epidemic in China at the time, not even a pandemic. develop, and I was on video with our Chinese team every week to see how they were doing. So we realized very early on that this was going to be a big problem. And so and then soon enough it hit Italy, and then it started expanding. But it was really interesting because when it was in China, a lot of people thought it's a Chinese issue. Then it got to Italy, and a lot of people were still saying, oh, it's an Italian issue. And then it started spreading everywhere. And we started, as of January of that year, we started very modestly. We were looking to buy masks in China to deliver this to some hospitals. It's hard to believe, but in those days, there were no masks.
Yeah.
And then we looked at our portfolio of products and we thought, what can we do to help and repurpose some of our medicines? We developed an antibody, a long-acting antibody to protect the people who don't respond to vaccine, because we have a lot of antibody technologies. Yeah. And in the course of doing this, we came across Oxford, who were working on a vaccine, and that must have been around March, April of that year. And we thought, okay, well, we can help, and let's do it. And we felt at the time, now is the time for us to give back and help the world with this pandemic. And it was really interesting because a lot of people in the company could have said, don't do this, too risky, we should not do it, blah, blah. Nobody said this. We all said, let's go. And it was not perfect, but we definitely delivered 3 billion doses globally. Mm-hmm. It was estimated independently that we saved 6.5 million lives. 90% of people in India received our vaccine. I think 50-60% in Brazil and throughout Latin America, in South Asia, in many, many countries. Because you need to remember at the time, the Pfizer vaccine and the capacity was limited, so it was mostly for the US, and Moderna mostly for the US, and then Europe a bit. And then the rest of the world was mostly Chinese vaccines and our vaccine. And then, of course, Pfizer did a great job, so they could supply the whole world. But in the early days, our vaccine was really the only one that people could access.
Yeah, here in Mexico, it was a combination of Argentina and Mexico in terms of production. Yes. And the standard was Astra in terms of that vaccine.
We decided to do it at no profit, which, of course, as you can imagine, was a very important decision for many countries around the world that could not afford expensive vaccines. We often, people who live in Europe or the US often forget, and I tell them, add Europe and in US together, US plus Europe, you only have 10% of the world population.
Yeah, exactly.
90% live outside those regions. And many of those countries are low middle-income countries. And so a lot of these countries in Africa, in South Asia, etc., really benefited a lot from a no-profit, low-cost vaccine, which also at the time was easy to distribute. If you remember, again, many vaccines are great vaccines, but in the early days, they had to be kept at very low temperature.
Exactly.
Imagine high temperature countries. It was very difficult. Yeah.
And it was like a terror movie in terms of it was in a slow motion, because we knew, for example, at the end of 2020, that we need to make an international fund in terms of have vaccines all over, or we're going to have variants, and we did, even when we knew. So that was for me an important lesson in terms of we humans are not very good in terms of the abstract thought when you're seeing some developments. No, that's why maybe history repeats itself.
Yeah, and the early days were actually very scary because the vaccine, the virus initially was actually going into your lungs, and people would have, they basically their lungs would not function anymore, and there was no vaccine, there was no treatment initially, and I remember they would put people in artificial coma. And if you were put on artificial coma, you had only 50% chance to come back from it. So they would tell you, okay, we're going to put you in artificial coma, but we're not sure you're coming back. So imagine how crazy and scary it would have been. There's one person around me in the company, very close to me, that lost her mother in London in the early days, could not even go see her mother in the ICU. She died and nobody could see her and say goodbye. And then they lost the body.
Yeah.
in London, but also in Paris. There were quite a number of bodies of people that were misplaced.
Yeah.
Unbelievable, right?
Unbelievable.
And
Yeah.
they were found, of course, over a few days. But it was really scary. And then the virus mutated. And over time, it basically limited itself to the upper respiratory tract, stayed in your nose and in your throat, and it became less dangerous. Very contagious, but much less dangerous.
Yeah.
And then the vaccines, of course, came. Yeah.
And I remember Boris Johnson, Prime Minister of UK, and he made like the pump, and he was in intensive care, right? So even the political leadership was not very good in terms of identifying the risk and communicating, as you say at the beginning, which is very important in a crisis situation.
Yeah, and then, if you're a government leader, of course, you're going to meet people because that's your role. So if you meet people, you're going to be exposed. And he was infected before vaccines were known. He was actually infected before treatments were really discovered. It was early days, and they would give you oxygen and a couple of treatments, but it was very limited.
And good luck.
Yes. And he did well, thank God, and recovered, but a lot of people didn't, and a lot of people died in these early times. Yeah.
Now, that was the abstraction in terms of the pandemic, but now we face some other, maybe positive abstraction, for example, AI. You have Milton, you have developed. How do you imagine, for example, in terms of your track record in terms of vision is very good. You already say that in at the end of this decade, $80 billion of revenue. How do you imagine is going to be AstraZeneca in 10 years, in 2035?
That's a really great question because the industry, the pharmaceutical industry is changing at a really rapid pace because science and technology is exploding, and new technologies, new products are emerging all the time. So we have a strategy, and we always focus on what I call today, tomorrow, and the day after. So today is 25, 26, and we have to deliver our pipeline progression, our financials, of course. Tomorrow is the period 26 to 2030, is launching our new products, etc. And the day after is post-2030. So what happens?
Yeah.
Let's assume we get to 80 billion, and what happens after that? And so we have been working on making choices as to what are the technologies that will make the future of medicine in the long run. And so we are investing in many technologies, cell therapy, gene therapy. We're investing in antibody-drug conjugates, where you have an antibody and you combine it with a toxin to kill cancer cells, so-called targeted chemotherapy, right? Or smart chemotherapy. We're working on also weight management. We're working on all sorts of bispecific antibodies, all sorts of technologies which we believe will actually shape the future of medicine.
And how do you see because there is a double challenge. You can have the technology and the solution, for example, of many oncology cancers, etc. But then the health system all over the world are under a big stress, and the societies are getting older. Obviously, Europe's, Asia, even China, 43 years average age. Mexico, right now, we're kind of at the end of the young or demographic bonus, but in 2035, we're going to have a big problem in terms of the decreasing. What could be a good way, or what is your vision in terms of the health systems in order to be solvent or be profitable, in order to have not just the medicines and the treatments, but to deploy them?
That's a great question, and suddenly across Latin America, populations are young, as you say today. But of course, they're going to get older, and as you get older, you cost more. That's sort of the reality of biology and medicine. I think the key is really to keep people not only living longer, but healthy and working longer. And maybe it's a bad news for people who gotta
I love work.
live longer, but we're gonna have to work longer. And not everybody is ready to accept that reality, but it is a reality. Because you need to create economic value so you can reinvest that in your health and your education. So to me, of course, prevention, good lifestyle, etc., is number one. But the next thing you can do that we actually work on, partnering with governments in particular, is diagnose people early. So if you have cancer, if you're diagnosed early, then you can be cured.
Exactly.
If you're cured, then it's very cost effective, right? Because people can go back to their life. It's good for them, of course, but they also don't cost money anymore. So early screening, diagnosis is important, and we're working on campaigns to do this. For instance, across Latin America, we have a program. We have scanned 500,000 scans using traditional X-rays that people have done of their chest for chest infection or something, using a very simple, or not simple, but inexpensive AI technology to scan this and diagnose lung cancer early. Then you can cure people.
In a huge scale.
Yes, in a big scale. The other thing you can do to improve basically the cost effectiveness of intervention is to cure people. So if they are not diagnosed early, if they are metastatic, develop a regimen that will cure them. And I think that is going to be soon possible. And again, if you cure them, even if it costs some money, as soon as they are cured, they can go back to normal life and contribute to the economy. So early screening, diagnosis, treatment, and also new technologies. Diagnosing people early with kidney disease, very important in Mexico.
Yeah.
Because 25% of people, 1 out of 4 person aged 60 or above, has diabetes.
Yeah, that's
So, and then they will have kidney problems.
And it's very expensive.
It's very expensive. So diagnosing them, treating them with very inexpensive treatment like SGLT2 treatment, then that delays the progression of kidney disease. So some of these interventions will help healthcare systems manage costs. Yeah.
Exactly. And would you think we're going to, maybe in 2035, cancer is going to be like polio now, like something on the past? Do you think that's realistic, or we're under?
Not yet.
Not yet.
For some cancers, we're not far from this. But I think over the next 5, 7, 8 years, a number of cancers can be cured through the combination of antibody-drug conjugates and immuno-oncology products and cell therapy. Then you can actually potentially either cure people or bring them to a durable remission. So
Exactly.
they live with their chronic disease a long time. So I think the horizon of this is not far.
It's not fair.
So
Yeah.
let me give you an example, for instance. Breast cancer. Today, breast cancer can be cured because women are diagnosed early.
Yeah.
And metastatic breast cancer, there are a number of new medicines that help either maybe not cure, but help people live much, much longer. And cell therapy, I think, will be a way to actually transform the way cancer is treated.
Yeah, and probably the discussion about the health system is very relevant, because we have already solutions to we have treatments for many of the big problems, but in some parts of Mexico, for example, you can have the best medicine available, but in others you're not, and tend to be massively the diffusion of this kind of solutions, right? So in terms of the scale and the cost structure, is going to help in the future.
Yes, actually, it's you're bringing this question of health equity. And actually, often when you talk about health equity, people have in mind, poor countries, etc. That is true, but it's also now a question of where you live. Even in a rich country like the United States, where you live makes a big difference. Makes a difference in terms of whether you're diagnosed, whether you go to a doctor who knows how to treat you or where to sell you, and also what kind of treatment you can get access to. And it's also true in Mexico. One of the things we do here in the region, in the country, is we partner with organizations to do early screening of patients, to diagnose them early. And we use technologies, satellite-based technologies, to deliver medicine by video, so that people have at least a chance to be diagnosed and then access medicines. But of course, accessing innovative medicines is a challenge. That is true in Mexico, but I can tell you it's true in many rich countries or richer countries, including the United States.
Now, what about innovation? Because it's right now the common view is that in Europe you don't have that much innovation because many people is thinking in technology. But AstraZeneca, $12 billion is not a little money, and also with the intersection of AI. How do you see, or what is your take on innovation and managing $12 billion of budget of that?
Yeah, it's a very good question. Actually, in our industry, and I have to say it's probably true of many other industries, anything that is technology, innovation based, the US is really leading in the world. China is becoming a very important contributor to innovation, of course, in technology and AI, but in our industry, in biotechnology, very much so. There's a lot of innovation coming out of China. US, China are the two biggest contributors. Europe, much less. And it's unfortunate, but that's the way it is. And so a lot of our investments in R&D go into the US, of course. We invest in China. We also have two R&D centers in Europe, one in Cambridge in the UK and one in Sweden. But more and more innovation is going to the US these days.
Is it a thing of regulation or talent in terms of young people and having the environment in terms of innovate? What is the problem in Europe and maybe in Latin America? Because, I mean, we're vibrant and everything, but we tend to not patent and innovate that much.
Yeah, I think that it's also a great question. I think the US has, the very strong fundamental research base, public but also private. Then it has a lot of risk capital.
Yeah.
People who are, venture capital, people who are prepared to take risks. The US is focused on innovation, on growth, and is ready to take risks. In Europe, investors are a lot more cautious. In China, people are prepared to take risks also. So it's a mixture of having the fundamental science, but also risk takers that will invest in your science. But it's also a question of making sure your products can actually benefit patients. And in Europe, the restrictions on access reimbursement are such that there's much less incentive to invest in R&D in Europe, because really your medicines are going to be benefiting patients in the US rapidly, much more slowly in Europe. Now, if you look at Latin America and Mexico in particular, Mexico contributes to a research and development effort, actually. We have a lot of clinical trials that are ongoing here in Mexico. We have very good teams. And so Mexico is a very important part of our global network.
And that's very good to know and hear. And how to navigate the geopolitical situation right now, because you being the biggest pharmaceutical company in China, and we're getting right now, not right now, but a couple of years ago, a divorce, even in the first Trump administration, then with Biden, it continued this getting far, and right now is going forward. So how are you navigating this complex scenario?
Yes, it's certainly not always easy. Our mission, really, and we try to stay focused on our mission, which it is to develop and bring medicines to patients everywhere in the world. We're the company with the largest geographical footprint. We're present in almost every country in the world. In Latin America, we are number one. So we stay focused on this and we stay away from politics. I mean, as a company, our mission is science and patients. It's really not politics. Now, on a practical level, we have a supply chain dedicated to China. And then we have a supply chain dedicated to the US and Europe. So we have supply chains that are almost completely, but not completely, but greatly independent from each other. So we can supply the US from the US, and we don't face those tensions between countries.
That's true. And also every government want to benefit its population, so they will not object to have a new discovery and R&D budget.
Exactly. Right? I think ultimately, we should take advantage of innovation where it is. And If China has a lot of good scientists to invent new medicines, we should help them develop and distribute those medicines that can help people around the world. So I think really, ultimately, governments want the health of their population to improve, right? So they will want to have access to medicines wherever they come from.
Now, a more personal question: how do you manage your time? I'm sure that you have a lot of people that help you in terms of knowing you have this interview, and after this, and you're all over the world because the footprint of AstraZeneca. But what is the discipline, or what can you tell to some other leaders in terms to have a good strategy in order to have this huge management position?
This is a great question. First of all, you have to love what you do. I love what I do. And so some people sometimes try to separate your private life, your professional life. Actually, if you love what you do, your job is part of your life. I mean, you spend more hours working than being on vacation or on private. So having said all of this, I think it's important to take time out for yourself. And I try to exercise if I'm on the road. I mean, I'm on the road most of the time. My assistant knows I will only go to hotels that are non-smoking hotels and have a gym. Exactly. I go to the gym in the morning.
You go in the morning?
I go in the morning, yes. During the weekends, I try to go cycling. I like cycling. I have a back in many cities. I have a back in Washington where I have an apartment there. And so I go cycling during the weekend. I think it's really important to take time out, and I believe exercise, especially as you get older, you have to exercise because that's really fundamental. So balancing your life that way, and of course, taking time also to spend time with your family is an important dimension. So, I think if you love your job, those questions are relatively easy to resolve. Yeah.
And you're not structured time in terms of consuming additional information, because I guess you need to read a lot of reports, a lot of data, the pipeline in terms of the evolution, etc. But also maybe you need some outside information so you connect new dots that are not available when you're just inside the bubble of the things you need to.
But these days you can optimize your time, right? It's not like the old days where you had to wait for paper. I mean, you get everything electronically. So I'm on a plane, I will read. I'm on a train, I will read. I'm in the car. If I have a driver driving me somewhere, I will read. So I think you can optimize your time this way. And then second thing is, I try to spend a lot of time talking to people, internally in the company, but also externally. I go to congresses. I go to the ASCO, the biggest cancer congress in the world every year. I go to many of these congresses. I meet with doctors. I try to ask questions and hear them. Because the biggest challenge we face as an industry or as a company is we're working on products and technologies, but suddenly something can come from left field, as they say, and surprise us. So we really have to look constantly at what is the new product that could come and disrupt the treatment of a disease where we have a strong presence.
Did it amaze you, for example, the general artificial intelligence, Gen AI, ChatGPT? It was amazing for you, or you say, okay, that technology, because obviously as a pharmaceutical company, you already knew and you were working, I know, in artificial intelligence in terms of science, but now you have this management tool that it's amazing. How was for you this?
Yeah. I should also say that I have a great team. I don't know everything. I don't have to do everything. I have a fantastic team today. Now, in terms of your question about AI, it's completely changing the way we operate the company. It's helping us develop, discover new targets, new treatments. We have right now 5 or 6 new medicines in preclinical development that came out of AI efforts to come up with new targets. AI is also helping us develop our products faster. It's helping us develop diagnostic tests. It's helping us manufacture products, commercialize them. So it's really helping us across the board. It's helping us optimize molecules. In the past, it would take us 6 months. When you have the scaffold of a molecule, you have to optimize it. It would take us 6 months. Now we do that in days. So it's much, much faster. On a personal level, I use it all the time. I use I use ChatGPT, I don't know, 6, 7, 8 times a day.
For questions or
Questions.
or
Any question I have, professional or even personal sometimes. And I've started using Grok 3. I don't want to do any advertising or any tool, but Grok 3 is also a fantastic tool. So I use those tools, and honestly, they've changed my life because any question I have, I get the answer very quickly, and it's very structured. Yeah.
And in terms of the business process, because this is my idea, but I'm not in a position of leadership as you are, but maybe the reports can be faster. For example, something that before, for example, you want to know the R&D budget in Mexico City, its correlation in terms of the outcome and the inflation. Now you can have that in 5 minutes.
Absolutely, absolutely. I mean, access to data is key, and we have this, but AI is also helping us produce protocols for clinical trials. It will sort of help us or help our scientists design the protocol and the studies. It will help us produce contracts, legal contracts, all sorts of things.
Yeah.
Now, it cannot replace human beings. Ultimately, it's really enable human beings to be more efficient, but you still have to supervise and check, of course, the quality of what is produced. Yeah.
Almost least, what is your favorite part of your job? I mean, I know everything, right? But maybe you have something that you say, I really love this part, and we tend to be good in one things, not so good in others, in terms of...
The number one thing I enjoy the most is talking to people in the company and outside the company. In a company, you have also a bit of administrative work. That is not the most exciting. What excites me is to meet doctors, experts, and scientists and listen to them. And then on a more practical basis, what I love doing is spend time on the pipeline. In our industry, the most important period of time in what we call the value chain is when you transition products from early development to late stage phase 3 clinical development. Because phase 3 costs a fortune. It can cost several $1 billion to develop a product. And you can run a phase 3 trial that will cost you $500 million or $1 billion. And at the end, it fails.
Yeah.
So when you move into phase 3, you can't be 100% sure, but you have to be confident it will work. So spending time in this period of moving from early development to late development is the most exciting period, also because it is when science meets the clinic. It's when you look at a science, a new product, and you think, okay, where can it help patients and clinicians?
And the financial part, obviously, because you need to see the market in terms of this is going to be. If not, the Wall Street and all the investors are going to not be happy.
Absolutely.
With that other part.
You need to know where this science can help patients. And then, of course, you have to have great teams that assess the product and its potential and then see whether it makes sense or not. But it always starts with the science and getting a sense of clinically where would it help patients. The industry average in phase 3 is about 65%, which means 35% of projects fail. We have been more around 85% success rate. So we've been relatively successful in the last few years, but we still fail 15% of the time. And somehow you have to fail. Because if you don't fail, it means you don't take enough risks.
Exactly. And that's very important in terms of the capital, because if you're thinking of $100 million, it's not like that, but $12 billion, you're going to fail on that amount, 15%. You need to understand that, and that is a very important thing to communicate in terms of the price of things, because it has an implicit risk that you took.
Exactly. That's what is hard to convey. People look at the price, but the price of a medicine is not the price of manufacturing it, even though new medicines like cell therapy are very expensive to manufacture. But fundamentally, it's the price of developing, and even more importantly, it's the price of failure, because a lot of the money will fail, and so you have to consider the cost of failed projects and build it in the cost of the existing products. The other concept, which I think is really important, is hard to convey, is that society has to pay a fair price for 15 years, let's say, for medicine, and then it will get it almost for free for the rest of time. When my grandson was 6 months old, he developed a urinary tract infections, and everybody panicked. We rushed to the hospital. And in the end, he was prescribed a bottle of Bactrim, which is an antibiotic that is manufactured, was invented by Roche. I was working at Roche at the time. It was a coincidence. I went to the pharmacy and bought this, $4. And then I thought, you know what? For $4, we saved his life. Because before the existence of this antibiotic, he would have had probably a kidney infection, he would have died, or he would have been handicapped for the rest of his life. And that's true for every medicine we develop. After a certain period of time, it becomes almost free, and it benefits humankind forever.
And that raises a question in me. 15 years is okay, or maybe we should make it more cheaper, but 30 years, or the mix of new discoveries, because you say, okay, 30 years, I'm not investing 12 billion, maybe
Yes.
4 billion. Is that the right amount?
That is a great question, actually, because, of course, the shorter the period of exclusivity, the higher the price, because you have to recoup your investment. Ideally, you would want to have longer period, lower prices.
Exactly.
I think for us, we as an industry, and I don't want to speak for my colleagues in other companies, but for us as a company, we would prefer to have lower prices, longer protection. Why? Because if you have lower prices, we can help more patients benefit faster. And if you have longer protection, so that's the benefit to society. The benefit to us as a company is we don't really have to worry constantly we're going to lose patent protection. We have more time to invent new things. So I think it's a win-win. The problem is how do you make this work? It's quite complicated, yeah.
Well, maybe that's with that I would like to close. I'm very grateful that you have the time to talk to me, and to talk to the Mexican people that is going to hear this. Thank you very much, Pascal.
Thank you so much, Rodrigo. Always a pleasure to be here. I love Mexico City, and most importantly, love the food here.
Yeah, exactly. You need to eat tacos and many things. Thank you. Pues muchas gracias a ustedes por acompañarnos. Un verdadero honor tener pues a uno de los líderes de una de las compañías, ya escuchó usted, de la más grande, la que tiene la huella más grande a nivel internacional.
Hasta aquí llegamos con nuestro invitado de impacto y su historia de éxito de esta ocasión. Hasta la próxima.
Esta es una producción de Excelsior Podcast. Derechos reservados. México 2025.